Welcome to this edition of DMC Medical Matters. With us today is Dr. Aziz Alkatib, a cardiologist here at the Detroit Medical Center. Dr. Alkatib is here to talk to us about heart health. Dr. Alkatib, let's start with the basics. How prevalent is heart disease, and what is the impact of heart disease in our community?
Well, thanks for having me to talk about this very important topic. Heart disease is extremely prevalent. It is the number one killer in the United States. Over 600,000 Americans die each year from heart disease, and it accounts for 1 out of every 4 deaths. And so it's very prevalent. And it's a disease that not only affects men, but also affects women. In fact, there's a misconception that this disease only affects men, which is simply not true. More women die of heart attacks than men. The good news, however, is that up to 80% of heart disease is actually preventable. So there are steps you can take to reduce your risk.
Now, you mentioned heart disease being preventable. Some people are on medication for heart disease, but some people require more than that. Tell us about the procedures and treatments that are available here at the DMC.
Absolutely. The DMC has a wide variety of tools and techniques to combat cardiovascular disease. For those who are interested in early detection, prevention, perhaps you have a strong family history. We have diagnostic and screening tools to help potentially catch a problem before it becomes serious. For patients with established heart disease, we frequently offer catheter-based techniques such as angioplasty and stenting, which is a safe and effective way to open up blocked arteries. For patients who suffer from arrhythmias, there are specialists who again offer catheter-based procedures such as ablations to treat arrhythmias such as atrial fibrillation, which can put you at risk for having a stroke, in addition to other therapies such as pacemakers and defibrillators. And finally, for extensive or complex heart disease, we have an outstanding surgical team that performs open heart surgeries such as coronary grafting and valve replacements. So no matter what cardiovascular ailment we have the resources and expertise to help.
What is one thing people can start doing today to improve their heart health?
Absolutely. Like I mentioned earlier, much of cardiovascular disease is preventable. I would say number one is if you smoke, you have to quit smoking. By and far, that is the most important change you can make if you are a smoker. Otherwise, next is to focus on good nutrition, and that generally means more produce type natural foods and less of the refined processed foods and less sugar. Also important is exercise, and we recommend to shoot for 20 to 30 minutes of physical activity on most days of the week, and that can be simply walking. And finally, often neglected, but it goes without saying, is to see your doctor, okay? If you can't, you have to be proactive in your health, and you're not gonna find out what's wrong unless you talk to your doctor and make an appointment to visit with your doctor. Oftentimes we can determine if there's a problem with simple questionnaire and screening tools.
All right, thanks Dr. Alkatib for your insight and information. And thank you for watching. For more episodes of DMC Medical Matters, visit our website at dmc.org/medicalmatters.